Which vein is most commonly used for central venous catheter insertion? Cephalic vein, subclavian vein, basilic vein, popliteal vein. The correct answer is option B, subclavian vein. What is the average amount of gastric juice secreted daily in an adult human? 500 ml, 1 to 1.5 liters, 2 to 3 liters, 4 to 5 liters. The correct answer is option B, 1 to 1.5 liters. Mammography is used to detect which disease? Ovarian cancer, cervical cancer, breast cancer, lung cancer. The correct answer is option C, breast cancer. What is the term for the semi-liquid food in the stomach? Chyme, bolus, feces, serum. The correct answer is option A, chyme. Which of the following IV fluids is contraindicated in a patient with traumatic brain injury? 0.9% sodium chloride, lactated ringers, 5% dextrose in water, hypertonic saline. The correct answer is option C, 5% dextrose in water. What is the normal pH of gastric juice? 1 to 2, 3 to 4, 5 to 6, 7 to 8. The correct answer is option A, 1 to 2. Which of the following findings in CSF indicates bacterial meningitis? Increased glucose, increased lymphocytes, increased neutrophils, decreased protein. The correct answer is option C, increased neutrophils. What is the primary action of a beta-adrenergic receptor blocker? Decreases heart rate, dilates bronchioles, constricts blood vessels, stimulates glycogenolysis. The correct answer is option A, decreases heart rate. What term refers to the administration of a drug into the cerebrospinal fluid? Intrathecal, intramuscular, intravenous, oral. The correct answer is option A, intrathecal. Which test is used to confirm pregnancy? RFT's test, ultrasound, urine HCG test, Combs test. The correct answer is option C, urine HCG test. Failure can be caused by all of the following except blood loss, dehydration, hyperpigmentation, shock. The correct answer is option C, hyperpigmentation. The eye speck test is commonly used to diagnose which condition? Myasthenia gravis, multiple sclerosis, Bell's palsy, Turner syndrome. The correct answer is option A, myasthenia gravis. Which vaccine helps prevent cervical cancer? MMR vaccine, hepatitis B vaccine, HPV vaccine, polio vaccine. The correct answer is option C, HPV vaccine. In patient receiving total parenteral nutrition, which metabolic disturbance is most common? Hyperkalemia, hypophosphatemia, hypernatremia, hypocalcemia. The correct answer is option B, hypophosphatemia. What is the most common complication associated with the use of a large bore IV catheter? Hematoma formation, thrombophlebitis, air embolism, infiltration. The correct answer is option B, thrombophlebitis. What is the average normal volume of cerebrospinal fluid in an adult? 50 to 100 ml, 120 to 150 ml, 200 to 250 ml, 300 to 350 ml. The correct answer is option B, 120 to 150 ml. What is the most effective method to assess fluid responsiveness in a patient with shock? Central venous pressure monitoring, passive Legrez test, arterial blood gas analysis, serum lactate levels. The correct answer is option B, passive Legrez test. Which spinal level is typically targeted for a lumbar puncture? L1 to L2, L2 to L3, L3 to L4, T12 to L1. The correct answer is option C, L3 to L4. Which part of the nephron is responsible for the majority of sodium reabsorption? Distal convoluted tubule, proximal convoluted tubule, loop of Henle, collecting duct. The correct answer is option B, proximal convoluted tubule. Which imaging modality is most sensitive for detecting acute ischemic stroke? CT scan, MRI, X-ray, Doppler ultrasound. The correct answer is option B, MRI. Which of the following antibiotics is incompatible with lactated ringer solution? Vancomycin, ciprofloxacin, ampicillin, erythromycin. The correct answer is option C, ampicillin. Which vitamin is synthesized by gut bacteria? Vitamin A, vitamin B12, vitamin D, vitamin K. The correct answer is option D, vitamin K. What is the first line treatment for anaphylaxis? Antihistamines, epinephrine, corticosteroids, salbutamol. The correct answer is option B, epinephrine. The method of drug administration involving placing a drug under the tongue is known as intramuscular, sublingual, oral, intrathecal. The correct answer is option B, sublingual. Which of the following veins is preferred for central venous catheterization in patients with coagulopathy? Internal jugular vein, subclavian vein, femoral vein, external jugular vein. The correct answer is option C, femoral vein. What is the most common electrolyte abnormality caused by rapid infusion of faked red blood cells? Hyperkalemia, hypokalemia, hypercalcemia, hypermagnesemia. The correct answer is option A, hyperkalemia. What is the purpose of using a pressure bag during blood transfusion? Prevent air embolism, increase the flow rate, reduce the risk of hemolysis, prevent clot formation in the line. The correct answer is option B, increase the flow rate. Thanks for watching. Subscribe to the channel for the latest informative MCQs.